to the session on Introduction to Employability Skills. In this session, you will learn about concepts related to employability skills. It is a NOS 4 of Nurse Manager program. You must be wondering, why employability skills? I am already skilled. I have undergone a training. Then why should I learn employability skills? If you know, employability skills are also known as soft skills. These are the skills which are transferable, and they actually are the key personal attributes that relates to the employee basic skills, soft skills, what they need in every profession. Employability skills are common for all the professionals or for all the job careers, but they are consolidated in some basic employability skill in particular sector. In the changing scenario, as when you go to the job market, every employer see what are the employability skills you have. Nowadays, they give more emphasis on the employability skills rather than technical or the hard skills. Technical or the hard skills are the job specific skills that is required by the professional during the job activities. But the employer always think hard skills you can learn even over the time on the job training, because every institution have their own procedures, have equipments, have machines which you learn to operate. But employability skills which are very important and essential aspects are looked into. Already I have told you, employability skills are set of attributes and abilities and personal qualities that our employer need to see in an employee for completing or for working for a job and to be successful. Employability skills required in the health sector. Employability skills are very crucial in the health sector because here we deal with the patients, patient safety, patient satisfaction. Therefore, you need to have skills like communication, teamwork, critical thinking, collaboration, data analysis, lifelong learning. Although in your basic courses, you have read about most of these skills, but it is very important to re-emphasize when you get promoted to a manager post, you need to refine your skills to become a good manager. So, employability skills, let us review what all skills are there. Constitutional values and citizenship, becoming a professional in 21st century, basic English skills, career development and goal setting, communication skills, diversity and inclusion, financial and legal literacy, essential digital skills, entrepreneurship, customer service, and get ready for job or interview. So in this, I will just tell you in brief what are these employability skills. Constitutional values and citizenship. You must have read about Constitution of India during your school. Constitutional values are the fundamental principles and ideals guiding the legal and ethical framework. These are the values that provide actually the fundamental guidelines for the government to run a nation. What is expected of the government and what is expected of the citizen. And who is a citizen? Citizen of a nation is given a legal status by the Constitution, who has rights and responsibility as a citizen, and they can vote to elect their representative. And within the framework of the Constitution, they have rights and responsibilities. Constitutional values related to health. If you see, and you must have read in your various courses, that core constitutional values for healthcare are concerned with human dignity, equality, social justice, right to life. There is no separate right to healthcare, but it is an integral part of right to life, that every person has a right to get right health services. These are articulated through preamble, directive principles of state policy, and there are also fundamental rights of the citizenship. In health sector, citizenship means as a citizen of a country, every person has a right to get the health services free of cost, accessible services, affordable at their doorstep. State is obliged to provide these services to the people so that they can avail the services at their doorstep, again, which are accessible, equitable, quality healthcare services. With latest policy of universal health coverage at their doorstep, even the financial aspect has to be taken care by the government. So you can see the Constitution clearly mention who is a citizen and what are the rights and duties of a citizen and what are the obligations of a state towards the citizen to provide the healthcare services. Becoming a professional in 21st century. This means not just having technical skills to become a professional, but there are other range of skills which are required, that you can say the soft skills, communication, collaboration, teamwork, critical thinking, adaptability, values and ethics, and lifelong learning. 4 C's are critical thinking, creativity, collaboration, and communication. Even National Health Policy says one has to have values and ethics in life. So every 21st century professional should have values and ethics, and lifelong learning is very important. Just once getting a degree is not enough. Even though you have PhD degree, still lifelong learning concept has to be part of the professional life. 21st century skills are health personnel in health industry. If you think it is very challenging nowadays, because the way the technology is changing, the AI technology is coming up. Every professional working in the hospital need digital skills, technological skills, literacy, legal skills, financial skills. They have to have analytical and critical thinking, because the complications, the type of problems, diseases are emerging. They have to critically analyze the situation of the person or the patient. As the technology is advancing, as the hospital is becoming overburdened, stress is there, more problems are being there, and managers has to solve the problems to run the hospital. So much of data is there in the hospital. So data analysis for decision making, for evidence and for research is very essential. Then you can say essential soft skills are very important, like leadership. One should have good leader, adaptability to the changing situation, health, legal, financial skills. These are very, very important to become a 21st century professional in the health sector. Basic English skills. English is a working language in our country now, because every hospital, especially urban and in various sub-districts also, reporting, records, and day-to-day working documentation is done in English. You are not going to learn about literature, but the basic English skills, fundamentals, so that you are able to listen what other person is saying and understand. You can speak and communicate. You can read the documents, treatment orders, diagnosis, and you can write your advices and the notes. You can work effectively with as a team member. That's why learning English is very important. Basic English skills for health sector include effective listening or active listening, verbal and non-verbal communication, and medical terminology. You have to speak in English because nowadays, with the advancement of medical tourism, you may get patients from various other countries. When you apply for abroad, first thing is you have to pass an English language exam. So, if you know the basic English, you can work in various countries. Except in some of the countries, you need a foreign language knowledge also. When you work in hospital, doctors write the treatment advices in English language. As a nurse, when you have to give the treatment, it is very important you have to read and understand what are the instructions, because you have to give treatment to the patient or carry out the procedure and interpret what doctor has written. And when you do a research, you collect the data and you have to interpret to bring out the evidence. That's why basic English knowledge is very important. Career development and goal setting. Once you join a nursing profession, after getting registered, you start planning for your future career, what you want to be, where you want to go, what are your skills, what is your knowledge, how you balance your professional life, your family life, what are your short-term and the long-term goals, and what is your pathway for your career progression. So, once you join as a staff nurse or a nursing officer nowadays, you may become senior nursing officer. Maybe sometimes in some of the hospitals, you may become ANS or DNS. But the pathway is very long because of promotions and less post. After 5-6 years, you may plan to change, or maybe after 2-3 years, you would like to change. So what you have to do is, you have to do your self-assessment. Set the goals. They have to be specific, measurable, achievable, and realistic. And they have to be short-term and the long-term time-bound goals. And sometimes you need a good guide and a mentor who can help you to choose your pathway and plan for your career. But you should be flexible. You should not take stress in case you are not able to achieve it due to certain reasons. Find out your strengths and weaknesses and overcome them. That means continuous lifelong learning and skill updation is very important for your career development and goal setting. Next is communication skills. Most important skill for any health professionals. Your active listening. Listening and active listening makes a difference. When you do active listening, you are actually trying to understand, have empathy, try to put yourself in other person's shoe, clarify what the person is speaking. You try to summarize and ask questions. What you have understood is right and what they are saying. You communicate in the language what your patients or your client can understand, but it has to be culturally sensitive, non-judgmental. You have to avoid the medical terminologies and jargons what we use in the hospital. Writing communication, that is how you write your notes, 3 shift duties, how you write your justification and demands for supplies and staff, how you write advices and care in the note sheet, because you are communicating to co-professionals what you need and what you want. That's why your written communication needs to be simple and clear. Non-verbal communication, body language, very important. When you are speaking to someone, eye to eye contact, what is your posture? Are you really listening to the person, or you are busy in writing or using your mobile? Person can understand. So your body language is a impact. 30% is your verbal language, 70% goes in the non-verbal communication. You have to communicate with your seniors, with your subordinates, with your colleagues, with the class support staff, with the doctors, with the higher authorities, with the patients and relatives. When you communicate with so many people, you have to see with whom you communicate, and you have to use the language what they can understand. Effective communication is very essential in healthcare to avoid misunderstanding, to avoid conflicts, to provide quality care to the patients, to collaborate as a team. That's why we say you have to be an active listener, non-judgmental. A good listener, polite speaker, speak a language what people can understand, culture sensitive. In our country, patients are coming from all over our country, and every region have their own language. So what you say, what you speak, how you make them understand is a challenge. But if you have skills of communication, you can communicate very effectively. Diversity and inclusion. There are two aspects. There are people from special groups who work in the hospitals as your colleagues. They come from diverse group, diverse physical, you can say disabilities, mental disabilities. You have to respect them, be non-judgmental, be cooperative with them and understand their concern. On the other hand, in the hospitals, you get diverse patients, all genders, male, female, third gender. You have to provide the services without any bias towards them. You have to see they get the basic facilities what they need as a special group. You need not be discriminating them for providing the services, providing the care. There are various studies which shows there are many people of other gender, they do not get services in the hospital because they are being discriminated, and medical staff, nursing staff are biases towards them. But we have to see that people with special disabilities have all the facilities, how to enter the hospital, they have railings, they have wheelchairs, they have someone to support, and all genders are respected equally as you give care to the other people. Financial literacy. In general, it's very important to have financial knowledge and abilities because you have to manage your finances as a professional. You get a salary, how much to save, where to save, how to maintain security of online transactions, because nowadays all of us do online transactions, but we should know which is the safe site, how to maintain the security and follow all the guidelines provided by the Government of India. The financial skills as a professional, when you are working in any institution or in the hospital, you have to get the budget. You have to be very cost effective. Billing is being done, reimbursements are to be done, insurance policies, Insurance mechanisms you should understand. You should be able to analyze the data. You should have critical thinking, leadership qualities, and the skills of a manager to handle the finances and various aspects. How to make a budget, how to provide cost effective care. When you plan something with the minimum cost, how it can be of quality. When billing is done, it should be accurate so that patient do not get wrong bills, and billing is done for the things which you have used for their care. If reimbursements are there, you have to understand the insurance and the reimbursement mechanisms and the policies. Legal skills. You have to interpret various aspects which are related to legal aspects related to your job or your profession. That means you have to understand various laws, acts, rules and regulation for the rights of the people. When you take consent for any surgery of any treatment or any procedure, how to maintain the confidentiality and privacy, safety of the patient and the documents, then various XP&DT Act, Personal Data Protection Act. Nowadays there are electronic health records are there, how to keep safety of those acts. What are the MLC guidelines when you get medical legal case? What are the procedures? When you get any rape victim, what are the policies and the guidelines to provide the care? That's why legal literacy as a professional is also very essential. Essential digital skill. This is the most important skills in our modern era. We cannot escape. Even if we do not know, we have to learn essential digital skills because electronic medical records is the future. In some of the hospital already it is there. Starting from the appointment till discharge of the patient, everything is done online. Even indent is given online. You have monitors. You have various equipment which work computerized, electronic equipments. How to handle those things, how to operate, how to maintain, how to handle the electronic and the online transactions and the patient's case sheets, diagnosis, investigations. These are the challenges, but one has to see how to update your digital skills so that you can work in a hospital or an institution effectively. Entrepreneurship. Buzzword today. Innovations. The young generation, they are so creative and they want to bring in innovations. Non-profit and social movements are there for leaving the job and becoming an entrepreneur. Because these are the skills you need to design something, to develop something new and to implement and impact the life of the people and the society. You should have the knowledge how to start a startup. What are the essential requirements to be an entrepreneur? From where to get funding and how to sustain your entrepreneurship startup. In the health sector, there can be various apps like telehealth apps. Online appointments are being done, online consultations are being done, various wearable devices are there, electronic medical records are there. There are various entrepreneurs who are trying to bring in various new, you can say, inventions and creativities which are helping the patient sitting at home and you can say doing monitoring and assessment themselves, and then it goes online to the doctor. They assess the condition of the patient. Online teleconsultations through apps or online are done and the patient get the best services even from the doctor sitting abroad, which patient could not think years back. So entrepreneurship, be creative and innovative, but for the welfare of the patients. Consumer services or customer services. Today our patients are considered as a customer because health has become an industry where mostly private sector patient is a consumer of the services. They pay from their pocket and they demand the quality services. So how good consumer services are being provided to the patients? If they go to the hospital, starting from the reception, they start having the impression you are a good provider of the services. Will they get good customer services? They get admitted. Best care if they are being provided. Your staff is polite. Communicate with them. Able to provide need-based services. They go back with satisfaction and they are the face value for you for other patients, and you may have further more patients in your hospital because they will go back and share their experiences. If they do not have good experience with you, they will go back and share that type of experience, and maybe the reputation of the hospital depends upon the customer service. So customer, as you go to the market, you choose certain shops where you will like to go every day. But same way, it is a hospital where your patient is a consumer. They will come to you even for the small things or the help or for the advices. So consumer services play very important role. One has to see what are the rights and duties of the patient, what are the rights and duties of the staff also, and what best services you can give as to your customers. So you can see patient will come back to you. If they have good experience, it will impact your statistics of the number of patients you get and expansion of your services if you provide good services to the patient. And the last is getting ready for the interview or for the job. Once you have attained qualification, hard skills, updated your soft skills, undergone various courses, and you have scrutinized what type of career you want to choose, shortlisted various organizations, you have applied for the job, then you are called for the interview. You have to see, are you ready for the interview? Again, you will do SWOT analysis. That is, what are your strengths, what are your weaknesses, what are the threats and what are the opportunities available related to that job, and have you done a self-assessment? Are you ready to possess that career? Same way, when you become a nurse or go to the health sector, it is very different working in an office and working in a hospital. So you have to make yourself physically and mentally ready that you will be working in a stressful situation where sick people will come. You will see all type of patients there. Are you emotionally strong? Emotionally mature? Will you be able to work as a team? Because in hospital, unless you work as a team, you cannot be successful. Are you committed towards your job? Are you ready to work in a diverse condition with diverse people, even during disasters? So all these questions will help you to get ready for the job. And when you go for the interview, have you taken all your documents, your personality, your dress, how you sit, how you communicate, how you answer, how realistic you are? What about your technical skills, employability skills? What are your capabilities? If you have already undergone any job, what is your experience? In which area you have experience? What about your digital communication skills? What about your evidence-based research, if you have any done? Is it being implemented somewhere? And are you ready for the social work, for the working for the society and the patients? So these are the basic skills, employability skills, which every professional, every person needs, irrespective in whichever field you are working. It is health sector, engineering, management, teaching, any other job, you have to possess these basic employability skills. They are the first criteria which employer sees nowadays. I hope this session has given you an idea what is employability skills and what are the basic skills before you start your career. Even during your career, you need to be an effective and a good professional. Thank you so much.